And welcome back. My name is Stephen. Um, I was diagnosed with breast cancer in my mid 50s. And during that process, I did like you probably doing now, jumped onto YouTube, looking for as much information as possible. And I just found that there was just so much stuff for women going through breast cancer and very little that relates to men specifically. So that's kind of one of the reasons I wanted to do this video series. And my aim really is to let you experience my journey as it happened to me. And hopefully that way it'll take some of the mystery and the fear, out of your own journey at the end of the day. So in my last video, I spoke about my journey through the diagnosis, leading up to surgery and all the tests and stuff. So if you haven't watched that, go to my channel. There's not a lot of videos. Go back and have a look at that video as well. Today, I'm going to talk specifically about my surgical experience, and I'll give it a recap, and I'll go through 5 things about my surgery, which I think you would appreciate. As a recap, um, my diagnosis to surgery was such a whirlwind. It just went. It was like crazy 3 weeks. Let's put it that way. So, just a quick recap. Week 1, on the Monday, I went to the doctor. Tuesday, I went for a mammogram and a sonar. Wednesday, I went to the surgeon and I met the surgeon, had a biopsy done. Thursday, I got my results and the bad news that I had breast cancer. Friday, I had blood tests and a heart sonar. Week 2, I went for MRI, CT scan, then started to arrange surgery. And a part of that process was to get authorization from my medical insurance. Week 3, I would have gone for surgery on a Tuesday, but because the medical aid was taking a bit long, I ended up going in on the Friday afternoon and spending Friday night at surgery. So it was like crazy. And as I said in my last video, from the phone call where my surgeon told me that the news was not good, I just kind of went onto autopilot and I made a decision at that point, maybe subconsciously, just to, just go through the process, just let it all happen, just take every recommendation, listen to what they have to say, and go through that process. So, first thing I want to talk about, and I did talk about this in my last video, so, you're welcome to go back and look at it, but I want to talk about the PET scan and why they do it and how that affected the kind of surgery that I had. So the PET scan or PET scan, I'm not sure what they call it where you are or where I am. Quite honestly, it's still one of those mystery machines to me. It looks very much like an MRI machine when I walked into it, and it's part of the nuclear medicine facility. So what they do is they inject a radioisotope into a lump, and then they give it time to spread. So it was like 45 minutes. Then you go back and you lie in the machine, and the PET scan basically can trace where the cancer is active because it can pick up it's kind of like an energy consumption level because cancer uh, needs a lot of energy and it converts glucose. So this isotope lights up where glucose conversion is taking place. And it was at that point where um, they confirmed that it had spread to the lymph nodes. So that changed my surgery from um, simply the area where my breast was, but also to include the lymph nodes under the arm, the removal of the lymph nodes under the arm. Second thing I want to talk about is what kind of surgery is it? What do you kind of expect now? I have to talk about my own experience. Whatever your surgeon recommends may be different. But as it was explained to me, because there's not a lot of breast material where the lump is, generally in men, they do a full mastectomy. In other words, they remove all the breast material and the nipple as well. And then in my case, as I said, um, they extended the cut, if you like, to get in under the arm so they could remove all the lymph nodes as well. Now, the PET scan, what they do is once they've isolated exactly which or where the lymph node is, the nuclear technician makes a mark with indelible ink, and you do it about 24 hours before surgery. And then a technician accompanies the surgeon and the anesthetist in surgery. And once the surgeon has done the mastectomy portion of the surgery, the technician then has an instrument to scan for the lymph nodes and assist the surgeon into getting to the right spot. That's why you have to do it within 24 hours. That's why you have to do the PET scan within 24 hours of the surgery. The third thing I want to tell you about is the actual surgery. And for me, it just felt like a very easy process. I mean, I've only had surgery. This is my second surgery I've had in my life. The first one was an appendectomy when I was a child. But I have been under anesthetic for working my teeth before, so I wasn't afraid of the anesthetic. I knew what to expect. Um, ah, just the team was just again just awesome, and I want to get back to how I spoke about the synchronicity of everything, of where I live, and how close all the facilities are to where I live. I mean, honestly, I moved from across the country. I chose a random place which looked pretty to me to live in. And thank goodness, because in this area, it's just literally 5, 10 kilometers, what's that, a couple of miles to maybe 10, maybe 15 miles at the very furthest I had to travel for any of the treatment or tests that I had to do. And they're big facilities, and I just never had to wait long for any of it. So back to the surgery. Great guys, great anesthetist. Of course, my surgeon is one of the best in the country, amazing enough. And he just made the process so easy. That wheeled me into kind of pre-operating theater, if you like, and gave me a pre-med, take some anxiety away. I mean, I wasn't really anxious, but it does help. And then wheeled into the operating theater. And, of course, they were just making jokes about how long I could stay awake after they open up that drip or whatever they do to get you under. And I tried to start counting. I was like, okay, 1, 2. I said, okay, I'm going now. And then I was out. It was so quick. And uh, I know before with anesthesia, I've come out feeling a little like I've cried coming out of anesthesia before, but that didn't happen this time. In fact, I was laughing and giggling. It was a funny experience. A lot of stuff I can't remember, but my daughter, she was there waiting for me when I came out of surgery, and she was telling me stories of how I was flirting with the porter and making jokes that I can't remember a thing. And wheeled back to the general ward. It was very nice. I had my own room, which was good. It was a semi-private ward, but there wasn't. I think there's room for 2 or 3 beds, but I was the only one in the room, so that was nice. There was a TV and aircon and everything you could think of. And the surgeon came to visit me afterwards, and he just told me that everything was successful and I could go home the following day. So Friday afternoon, and he said, well, Saturday morning he'll come and check on me, and then, then we can go. The fourth thing I want to talk about is the drain. So they remove a lot of material when they remove lymph nodes, and they insert a drain, which you have to carry around for up to 2 weeks. 2 weeks maximum. For me, it went the full 2 weeks. So basically what happens is, I guess during the healing process, a lot of fluid builds up. And if you don't have a drain, then the skin kind of balloons up with this, however the body's trying to, manage this trauma really, because it is a trauma on the body at the end of the day. So a lot of fluid builds up and it has to be drained. So it's a it's not a pretty process. I'll put some B-roll stuff up at the end of some of the draining stuff, but really what it is, it's kind of like I want to say like a spring-loaded suction pouch thing attached to a tube, but then goes in under your arm, kind of in this region, and then as the fluid collects under the arm, this kind of suction device sucks it out, and then once the spring is released and it's not, it doesn't have enough suction anymore, then you have to physically empty the drain, measure how much fluid came out, because you need to know how much fluid comes out in a 24-hour period. And depends on what your doctor says. If it gets to a point where it's under so many milliliters or ounces or whatever, however you're measuring, then the drain can come out. But mine never really dropped down below the kind of minimum level. So I had the drain in, and you have to have it removed after 2 weeks. They don't like to leave it for longer than 2 weeks. I'll be honest and say that that was the most uncomfortable part about surgery, was walking around with this drain. A couple of days after surgery, it was Pride here in Cape Town, and I went on the Pride March with my partner, and so I got this drain kind of installed. I shouldn't really have drank alcohol, but I did, and it wasn't terrible, and you do get used to it. But like sleeping with it, it's a pain, because it's in a position where you may turn and lie on it, and the drain doesn't work properly, and that kind of thing. So, and it's all messy. So I put like a like a mattress protector under me in case there was any leakage and that kind of thing. And the last thing I want to talk about is the drain removal. So, as I said, you have to measure how much fluid is drained every 24 hours. And actually, in the beginning, it was disgusting. But you quickly get used to it, and quickly become excited about, how many milliliters came out, over the 24 hours, and then keep a little log and manage everything. And, I'm a very much a spreadsheet man, so I've got all that going. And, but mine never dropped down to the level where they wanted it to be, where they could remove the drain before 2 weeks. It just kept on going. And then at the 2-week point, I had to go have it removed. The problem is, because my body was still producing this fluid, after they removed the drain, I had to go in every day, because the fluid would then still build up, and then the skin under my, in my armpit area would kind of bloat like a balloon, because it was still producing a lot of fluid. And then I would go in and have it removed. So one thing they don't tell you, or didn't tell me, that especially when they work on the lymph nodes and they remove all the lymph nodes, it leaves a whole area. I mean, it's still like that, and it's been, 2.5 years now. It's completely dead. So when to drain the fluid, he would just stick a syringe in, and then suck the fluid out. And I thought, wow, this is going to be painful. And he just said to me, no, it's not, because you got no feeling there. And it's true. And still today, I have no feeling there. But I'll talk about that, kind of the recovery period after surgery. But suffice to say that I'm still kind of dead there. And thankfully, I haven't had to take any medication for nerve pain, which some people apparently experience this nerve pain as it heals. But said mine just hasn't healed. He said that I may get feeling back in a year, 18 months, but it just hasn't come back. I can actually feel like the border of where, from no sensation to sensation, and it's hard to explain, but it kind of feels like a 3D border that I'm very aware of where the border is. I just hope that by me sharing is helping you on your journey. And if you feel you got something out of it, drop a comment, let me know. It's a brand new channel, so I'm pretty sure I'll read the comment and answer you. And I'm just wishing you all good blessings if you're going through the same issue, and I will speak to you next time.
Okay, that's right. Okay, so step 1, open the outlet valve up.
Yeah.
Empty the fluid content into a bag that you need to measure.
Yeah.
Then realign everything.
Yeah.
With your thumbs in that, just make it nice and neat. And you have to close it.
Right.
Because a vacuum will form.
Yes.
And it needs to be sealed up, and then reactivate it.
Right.
So that the vacuum can form with the spring on the inside.
How often do I need to empty?
So in the beginning,
Yeah.
you might have to do it twice per day because the fluid drainage will be foolish. But as things
I'll just do it at set times then.
Yeah. As you see that you only do it once a day.
Right. The first thing I do is grab my old cat bowl, which I don't use anymore, and a syringe. Once I've lifted that cap open, you see the vacuum, lets air into the bag, so the vacuum is gone. And then I empty that liquid into a cap roll. I know it looks yucky, but you get used to it very quickly. I'm on day 6 today, and the target is let's go back there. The target is, it should be less than 40 millimeters in 24 hours. Then he will remove it. Yesterday it was 100 ml, so now I'm going to take the syringe and just measure how much liquid there is and add it to what I removed before I got into bed last night. So it was 65 mils last night and 35 mils this morning, so that's 100 mils in 24 hours. And that's the same as the previous 24 hours. So I'm a little bit disappointed. I was hoping it was going to be under 100 mils a day. The same, my target is 40 mils, so I'm still somewhere from that. So he said to me either it drops below 40 mils or 2 weeks, and I'm day 6 now. And it's not a comfortable thing, it's awkward, and luckily the meds that I take at night for the nerve damage makes me sleep really, really well and in one position the whole night. So that's a good thing. I just place the bag next to me in the bed, and I kind of turn over and sleep in one position. So that's pretty cool.